Dear men, many a times her not getting wet for you again doesn't mean she doesn't love you. Please, I need to clear this fact. Men are beginning to think that the moment probably a woman gets wet for you, and then the moment she stops, this is your partner, and each time you touch her or want to initiate anything, she instantly gets wet for you. And all of a sudden this stops. You find out that you try hard and hard and hard, she doesn't get wet. That probably her mind is no longer there, she's no longer in love with you, or she's seeing someone else. Please be a reason, but 90% of our times it is not. You find out that you're always dry down there, your husband is always complaining, and maybe that's not how it used to be, or sometimes it has always been like that. Please listen to this video. If you're a married man and your wife is having these issues, listen to this video. I'm going to tell you how to get wet. Okay, it's part of my as a nurse. Today is not about the kidney. We're not going to talk about the kidney, the liver, the heart, EGFR, and all of those things. So it's about your home. If you're having kidney problems already, I will be telling you later on how to deal with, because most people that have kidney problem, especially those that have high blood pressure, don't have erection. Okay, and if you have CKD, of course you may not even ovulate, or your menstruation may so that will be on the next video. Or if you ask questions, let me know if you're interested to know this on the comment section. So like I was saying, this is not a reason. This your wife not being in love with you is not a reason, may not be the reason why she's not getting wet. Women, it may not be, you not getting wet doesn't mean that something is of course there's something going on, but it doesn't mean what you're thinking like so wrong with you. I'll tell you in this video what could cause this. Now, number one reason why a woman may not get wet is as a result of estrogen deficiency. This usually happens in the case of menopause. Okay, when your wife is hitting menopause, her late 40s, 50s, and all. Some women hit menopause early, so find out. So when your wife is about hitting menopause, or she has hit menopause, sex could be a trouble. She will find it difficult to get pregnant, to get wet, because the estrogen is what gives those liquid and moisturizes the vaginal area. So when you are hitting menopause, there's estrogen deficiency or reduction until finally it stops. So when estrogen is no longer there, your wife may not get wet the way she does get wet. In fact, you put out a lot of things to deal with this. I will explain what to do at the end of the video, so just keep watching. Then number two is that hormonal imbalance is one of the reasons that can happen to this. So when, of course, the estrogen is deficient or reduced, probably she's stressed, or testosterone is higher than estrogen, or just hormonal imbalance generally can make a woman not to get wet. So I will still tell you, remember, I will tell you what to do. Now, the next thing that could cause this is, of course, there's no romance. You just went in there or you just touched her. No, this can make a woman not to get wet. These are sensitive. We have nerves and hormones and stuff like that. So if you don't make her happy, if you don't make her take your time, getting wet may be easy, may be difficult. Now, the next thing that could cause this is stress. When a woman is psychologically, emotionally, and physically stressed, she may not even know that she's stressed. The kids are coming, she has a lot of things to think about, to cook, to care for you, think about dress these children for school, her career, her work, her job, family. She could be stressed without even knowing that she's stressed, and this is enough to make her not to get wet. So when you get married, or married people, just find a way to cut off this stress. Get as many help as you can get, because when a woman is stressed, her hormones will become imbalanced even without her knowing. Her body has a way of shutting down for her to concentrate, to reserve some energy. So all of those secretions are won't happen when she's stressed. So stress can make a woman not get wet, not even sexually aroused. She may not even know. So when she's thinking this, thinking about you, about the kids, about how to pay school fees, cook food, come back home, finish at work in the morning, dress, wake up by 4 o'clock, dress these kids so that they can go make your food, blah blah blah, she's stressed. She may not even know. And then probably you are now having arguments coming back home, and you're not telling her what she needs to hear. Where is my food, or stress from in-laws, from work, everything coupled together with the fact that she has to come home and satisfy you. This can alter the circle. Okay, so the next thing that could cause this is, of course, very very important, infection, untreated infections, particularly yeast infections. Yeast infection is very common with women. Please, this is all women. Just know that at one point in your life as a woman, you will have yeast infection. So men, please don't take it so because the yeast is in every woman. It's just that something makes it overgrow, and this is something women battle with. We have yeast infection kits. Okay, so if you want to order, just chat the number on the screen, and just say you want to order for the restoration our restoration capsule, yeast infection restoration capsule, and we get it across to you. It's 15,000 naira. It has 10 capsules, and you'll be told how to use it for yeast infection, stubborn yeast infection. Yeah, first. So just chat the number on the screen on WhatsApp, just request for it, and the secretaries will get you to you. Okay, so yeast infection, as simple as this is, can make a woman affect her ability of getting wet all of the time. So please treat all your infection. Sexual transmitted infection also can affect a woman ability to get wet easily. Okay, now the next thing that can cause this, very very important, is if she's having some reproductive issues, endometriosis, pelvic inflammatory disease, or any this can alter the sexual pattern. It can even make sex painful, okay, when this woman is having sex with you. Now, very important is smoking. People that are adamant, ardent or whatever, people that, I beg your pardon, people that are ardent smokers, and alcoholics. So this can imbalance your hormones, and so women tend to forget. They now use some of these pills and capsules, and to get wet. This is not nice. I'll talk about these dripping pills. That thing is not nice. It will give you your satisfaction immediately, but later it's going to make you more dry. We'll talk about that. If you want us to talk about that, put it in the comment section so I will know about dripping pills. Okay, so very important, if you don't take a lot of water, this can affect you as well. Okay, so very important, childbirth. Okay, childbirth and breastfeeding can affect your ability for getting pregnant because of the hormones that are produced, and still has to do with hormonal imbalance. Okay, so there's a hormone that is produced that prepares you for lactation. Okay, same thing as childbirth. So during childbirth, this hormone is prepared, and then during after childbirth, you start lactating. Okay, so this hormone prevents you from getting wet and aroused. So but it's just a matter of time. This can rebalance when you stop breastfeeding. So I'll still talk about how to deal with this, okay, generally. So childbirth and breastfeeding, if you notice that afterwards, you will notice that this place is no longer the way it used to be, and this is not for a cause of alarm. It's just a short term something. However, you have to be careful, because if you just leave it like that, you get used to it. It will now not be a childbirth breastfeeding thing. Your body will, you get used to it, and so now, very very important, the next thing that can cause this is what we call douching. Okay, washing inside your vagina. If you wash inside your vagina, you will find it difficult to get wet. So there's a way we wash the vagina, the vulva. You don't wash the vagina. Locate the video, check the links. I will post links on description box. Locate the video on how to wash your vulva. Okay, there's a way you wash your vulva. You wash the outer parts, those lips, inside those lips, not in the hole, inside those lips. You wash it, and you wash with mild soap. We have vaginal wash you can get, vulva wash you can get. Seal the child the number on the screen to order for one. So don't wash inside, don't put anything inside those places. Yoni pills, all of those things you put, cooking your vagina, so sitting in very hot water, this can prevent you from getting wet. When you give birth, there's a way it's done. It's with warm water. I will explain better. It depends on the questions I see on the comment section. That's how I answer. When I see a lot of questions on the comment section, then the next video I'll make the video. So you don't douche, you wash the outside of your vaginal lips, okay, and the hairs and everything. Wash it then with mild soap, okay, not your bathing soap. There's vaginal wash that you can use. Okay, so now vaginal douching can cause a woman not to get wet. That's dry vagina. Please, this is very, very important. Then there are some other things that could cause this. Some medications that you may be on, antidepressants, antihistamine. So have your medication reviewed, okay? Very important. This should have been one of the first, is contraceptive pills. These contraceptive pills, emergency contraceptives, of abusing them, for instance, Postinion 2, abusing them, which is taking them. You shouldn't take contraceptive pills. You shouldn't take contraceptive pills or emergency contraceptive pills like once in 5 months of 3 months. That's please give yourself like 5 months or so. It's an emergency. It's not for every day. There's contraceptive you can take every day, but this is emergency, once in a while. So when you're taking contraceptive pills, not just emergency, generally contraceptive pills, it may be probably to balance your hormone. This can make you wet, dry. Okay, so contraceptives can affect your hormones, and this can make you always dry. So please be aware of this. Then I've made mention of not being aroused. This can also cause this. There's some disease condition that can make a woman not to be wet. Diabetes can cause this as well, and some other illnesses that can happen. Now, very, very important, low libido. Some women have low libido. People that have low libido, usually people that their genitalia is cut, people that have circumcision, their clitoris is cut off or partially cut off, they can have high libido. Okay, so women that have like they can have low libido. So this can affect your sexuality as a woman, the ability to get wet easily. So now, having known about this, how do we deal with dry vagina? Number one way to deal with this dry vagina is, of course, please take it easy on this woman. Take it easy, take your time, don't rush the sex. Make her understand that you're coming to make her enjoy herself. You're not just coming to enjoy yourself. The first time you had your way with her, how you took your time, take your time the same way. Okay, so take your time. It's a gradual thing, and find out what is going on. Second thing is find out what is going on. If you've taken your time, foul play, everything is not working, find out, is there any cause for this, which could be menopause, infections, breastfeeding, hormonal imbalance, and so many things that can cause these illnesses. Some medication she may be on, hormonal contraceptives and all. So now when you now find out, you now deal with it. In the case of menopause, in the case of menopause or premenopause, estrogen prescription is done. It can come in gel form, it can come in medication tablet form, in session. So just meet your GP, your gynecologist can prescribe for you, tell you the ones to buy. If you don't have a gynae, we'll have one, and you can book consultation with them, and they can tell you what to do. If it's infections, try to check if you have infections. Do your tests, get treated. Remember, we'll have, for those that have recurrent yeast infection, we'll have treatment for this. The recurrent infection, try as much as you can to avoid recurrent infections. This can cause this. Then make sure you drink lots of water. Very, very important. Always hydrate, drink lots of water, and then take lots of fruits and vegetables, smoothies, green smoothies. These are very, very good in helping with your estrogen balance. It will help. Then avoid over the counter food, lot of carbohydrates, complex carbohydrates, avoid them, and eat a lot of fruit and vegetable. This will help you. Vegetables, cucumber, banana, apple, pineapple, juices, green juices, nuts, so these are very, very good. It will help you. Then very, very important, during breastfeeding and all of those things, just let your doctor know. They can you can use lubricants. Also, you can use lubricant. This lubricant will help your body feel like this is how it should be, so that after pregnancy, after breastfeeding, you can continue that way. So gradually make sure you bond with your partner in as much as you're breastfeeding. Bonding is very, very important during breastfeeding with your partner, not just with your baby. Partners bond with your wife. Very, very important. Then when you treat your infections, I'm sure everything will get back to normalcy. And then for those that don't want to use estrogen replacements, is very, very important, especially for those that are entering premenopause, women that are breastfeeding, that have just finished breastfeeding and they still find out that they cannot get wet. Hormonal imbalance may be there, so estrogen can be replaced, or your doctor may find out the hormone that is imbalanced and treats that. Now, very, very important is, please stop douching, stop pouring water inside that place, like water, anything inside. I'm not talking outside. Clean the outer part. The vagina is smarter than you. It's self-cleansing. These things come out as liquid. All those liquid you see, it comes out. Okay, so stop putting your hand inside that place. You are disrupting the normal flora. So you can talk to your partner when they are having sex with you. Tell them how much you love them. It's not about the sex, it's about them, to make them feel good. And during this process, you can now use lubricants. Gradually these things comes in to play. Then finally, if you've done everything and quit smoking and everything and it's not working, then I suggest a therapy for you, and this is vaginal rejuvenation by Tamiva. There's a wand that is used to insert in your vagina. This thing is mainly for vaginal tightening. Okay, look at the video I made about vaginal tightening, how to tighten your vagina. So it's a procedure for tightening the vagina, but one of its good effects that is, after rejuvenating the cells, it gives you the ability to get wet. Please don't use these dripping pills. I rather you use water-based lubricants than using the dripping pills. Please, I do not recommend it. Okay, all right. My name is Nurse Merit. I'm a nephrology nurse. Basically, dialysis, kidney is my specialty. We'll talk about kidney here, kidney transplant, how to make your transplant last, prevent chronic kidney failure, deal with it, health generally, women generally. So let me know if you have more questions, and put them in the comment section. To have a consultation with me, the number on the screen yet is still what you have to ask for. Ask them that you want to talk to me or to a doctor, and then they will schedule you for an appointment. To book an appointment, they will have to ask you to pay. But if you want a free consultation, send me messages on my social media handle. It will take time, but one day I will eventually get to them. Okay, have a nice day.